Well, listen, you and I have been talking a little bit recently about healthcare marketers in general and kind of where they should be focused today. And I thought that'd be a good conversation to have with you to share with folks about kind of where we should be focused today and how it's different than a couple years ago. What would you say to that?
Well, I think focus is where they should be focused is really kind of speaks to how marketing's changed in the healthcare space over the last, I'd say, 10 years, because it's been pretty dramatic. I think healthcare marketing in general, you'll hear this a lot, that it's a little bit behind other industries. I don't know if that's necessarily true. I think it's just different than other industries. But, when we talk about marketing in healthcare, there's definitely a split between kind of traditional marketing tactics, and then everyone talks about digital marketing and the digital front door. And I think that if you roll back the clock 10 years, the digital marketing piece was the smaller player within the larger marketing group, and over that time, it's become the dominant player now, I think, or it should be if you've got a modern marketing department. Just all of the tools, all of the ways you track your success lead to digital. But I think the other thing that's changed a lot is that the marketing group in health systems, I think traditionally has been kind of didn't have as good of a seat at the table when it came to the broader system. And I think that's changing too. I think marketers are finding themselves more involved in conversations around access and operations, around finance, around clinical care. They're getting dragged into a lot more conversations because they oftentimes have the tools to help solve the problems in those areas. So I think that, as a healthcare marketer, where you need to be focused is unfortunately everywhere. You need to be a jack of all trades. You need to, you don't need to be an expert in all of those areas, but you need to be able to speak the language, and you need to understand how those pieces fit together.
I would second that. And I know a lot of that, you just mentioned the tools. The tools have to do with what new tech is available in part. That's one piece of the puzzle, is understanding how those tools even help us. So, how does what advice do you have for marketers to even keep up with that one angle with advancements in technology? Some people refer to it as, the shiny new object syndrome, but how do we even keep up with at a basic level to when we do get that seat at the table to have those conversations with the different departments? How do we keep up and put our best foot forward?
Yeah, I think that the shiny object syndrome kind of comes from two directions, right? So if you work in a large health system, you're constantly being, invited to a meeting with a physician or some, service line director, and they're like, I saw this, or I know about this, and I want to do it. And so they're bringing technology. Technology is coming in from all these different doorways now, right? And then, as a marketer, you're being bombarded by vendors saying that they have the greatest new tool and solution. And I speak from a vendor position on that, right? But I think what's important is not to focus on the shiny objects, but to really just think about what are your challenges and what are your problems, and then go try to map to a solution. If you start with the solution and then go looking for a problem, usually you're not going to find the right fit. So I think really understanding what the problem is that you're trying to solve, who are the stakeholders involved in it, and then go look out to see where there might be a solution out there for you to solve that problem, and kind of back into it that way. I think if you run straight to the technology, you're going to ultimately have challenges. And I think that the last thing I'd say on technology is healthcare is ultimately a people industry. It's patients, it's clinicians, and it's all the other people around there. And technology is never going to be the total solution for anything you're trying to do in healthcare. There always has to be that human element, and remembering that and not trying to oversell a technology solution to your stakeholders is really important.
Yeah, I'd agree. I've seen that work both ways, successfully and not so successfully. I would definitely agree with that. It is probably one reason where you're coming from is my guess, when you're talking about our focus has to be everywhere. It's not just the tech part. We have to be able to speak to that and understand what tools are going to make sense with where we are strategically based on what needs we are trying to meet at that time. And I know, sometimes that can feel overwhelming on the provider side, on the marketing side, because you're trying to answer so many questions all at once. I know I have found, genuinely that it's helpful just to talk with colleagues and to realize first and foremost that I'm not the only one trying to answer those same questions, that there are hundreds, if not thousands of others out there in the world trying to answer the same questions, and that they've had successes in other areas that I haven't. And so to me, that kind of brings me back to this whole thought of professional development, of attending conferences, of networking in general. And I know for you've attended HCIC, the Healthcare Internet Conference, many times over the years. I'm curious how you feel like HCIC in particular, how it has helped in your own career. You've had kind of a unique path. You've transitioned from the provider side, like you said, to the vendor side now, and quite a unique perspective, success on all ends. And not trying to butter you up, just genuinely, there, a lot of people look up to you and the successes you've had. So how have those relationships you've developed at HCIC benefited you?
Tremendously. It's kind of helped me gain the success I've had, and to be able to have the teams that I've had. It's funny. I have been going to HCIC for a long time. I was actually just trying to think about when the first time I actually attended HCIC, and it was over a decade ago. And it's funny. I can remember when I first started attending HCIC, there were a lot of webmasters that attended HCIC, which is kind of comical, right? And it's completely shifted. Now it's everyone from the chief marketing officer on down to, web developers and digital marketing managers. And everyone in between. But as far as the benefits, it's all the things that you would assume, but I think they're true, right? So one is the professional development piece. One thing, I can tell you how it helped me in my career. Very early on, I saw a presentation. I think it was honestly the first time I attended HCIC. There was a presentation by a guy named Rob Curley from the Las Vegas Sun. And he was doing just some kind of interesting, innovative stuff with the newspaper website. And it was simply around tagging all of their content with geolocations and other things. And the idea of tagging content back then was a very new idea. And it wasn't commonplace in a lot of websites or content management systems. And he showed all the benefits of that. And that specifically, that idea, I took home with me and sat down with my team back at the University of Utah, and we started thinking about ways that we could tag health content to create a better consumer experience and to make it more searchable and just to make it flow better and connect together. And that was an idea that I wasn't really thinking about until I went to HCIC. And, from there, there's 100 other examples like that of just little tidbits that I've taken away over the year, stolen and brought back to my own team and been able to build success. And I think, obviously the idea is to take those good ideas and then put your own spin on it. Right. But and then you mentioned the connections and just the meeting other colleagues. I think within healthcare systems, we get so beat down. There's a lot of, I don't want to call it negativity, but, physicians by their nature question everything. And so you're constantly hearing this kind of second guessing of the things you're doing. And then you kind of live in this bubble. So getting out of that bubble, meeting other people that have the same issues. So there's a little kind of group therapy going on. And then realizing that one, you don't have a unique problem. And there's more than one way to fix those problems. And someone else has already figured it out. Great. Now you can take that solution back and go from there. And so, yeah, the people I've met, the relationships I've built over those years has created a network now for me to reach out, because I don't have all the answers, and I'm able to reach out to other colleagues that know how to do it better than I do. And then, it just grows upon that.
Thanks for a few minutes today, Brian, and good luck the rest of this week and this month, and hopefully see you there.
Yeah. Thanks for the conversation. Have a great one.